While you're waiting for the paramedics to arrive, you can start rescue breathing for a few breaths. What you'll want to do is place the person on their back. You're going to want to tilt their chin up to make sure the airway is open. You're going to check their mouth and remove anything that could be blocking the airway. You want to plug their nose with one hand and give 2 even, regular-sized breaths. Blow enough air into their lungs to make sure that their chest rises. If their chest doesn't rise, try to tilt their head back a little bit more to make sure that you're plugging their nose, and then try again. You're going to want to follow this with one breath every 5 to 6 seconds and check the person's pulse about every 2 minutes. You can check their pulse by putting your pointer and your middle finger just under their jaw on their neck or on the inside of their wrist. You do not want to actually perform compressions like you would see with CPR. In this case, the person's heart hasn't actually stopped yet, and that's what you use compressions for. If at some point you get to the point where you don't feel a pulse in their neck or their wrist, that's when you want to start compressions. After a few breaths of rescue breathing, place the person on their side again, and then go and get your naloxone if you have it. We'll talk about how to give the naloxone in just a minute. If there's someone else with you and you have naloxone, one of you should start rescue breathing while the other person goes to get the naloxone.